Mylan, the maker of the EpiPen, pointing the finger at Obamacare, the company blaming the president's health care law for skyrocketing costs of the life-saving drug. Individuals and families who need this critical drug still stuck footing most of the huge bill. That's why today a petition with over 700,000 signatures, the one you see here on your screen, there they are, was delivered to Mylan headquarters on behalf of consumers and EpiPen users. Our next guest helped lead this grassroots movement and is just one of the many concerned citizens leading the fight against Mylan. Director of Public Citizens Access to Medicines Program, Peter Maybarduk, joining us now from Washington, D.C. Peter, let's start with the petition. What exactly does it say, and what does it want Mylan to do?
The petition tells Mylan that it needs to drop its price, to stop with its evasive tactics, and reduce the price of this life-saving device back down to the $100 mark that it initiated back when the product hit market in 2007. This is a decades-old technology. Its development was funded in part through U.S. taxpayer dollars. The drug inside is 100 years old, and there's no excuse for Mylan's price gouging. Mylan just needs to cut the price.
So the attempts they've made so far, they started offering a $300 savings card, and now they say they're going to reduce the cost to $300 for some customers. You say that's still too high.
Well, it's a convoluted mechanism and won't do what it's meant to do. What Mylan is trying to do is preserve the premium market, be able to continue to sell its $600 EpiPens and also capture some of the generics market and look a little better. But $100 is more than a profitable price for this product. It's very strange to have a generics firm making a generic of its own product in the first place. Mylan's main contribution here has simply been an aggressive marketing and making sure that they sell as many EpiPens as possible. They're not contributing to the R&D, but it's a very scary thing, of course, for families to not have this device stocked, and it needs to be affordable so that families don't have to make tough decisions between paying their monthly bills and making sure they have security against their children's allergic reactions.
But Mylan is somewhat blaming Obamacare and the costs of all the middlemen in the process. In other words, we make the product, but by the time it passes through all the individuals that it needs before it gets to the consumer, the pharmacies, the pharmacy managers and so on, that's where the real cost comes. Is that true?
Well, that's a nice dodge, but we all pay Mylan's price in the end because we all pay for our health care system. We pay for our insurance premiums, and those have to be absorbed somehow. The insurers are certainly ripping off subscribers as well. They shouldn't get a free pass, but neither does Mylan. This is an extremely expensive product with no justification, and all of us pay either through our copay or the entire price, which can be several $100s if we don't have insurance, or through our insurance premiums, and our system simply can't bear this kind of price abuse. And there are solutions. Congress can act to pass legislation against this kind of a price gouging, and it generally just reflects the broader problem of monopolies. Pharmaceuticals are not a free market. Mylan is running away here with the fact that it's been able to corner this market based in part on government-protected exclusivities, and it's really competition that we need in action to induce more market competition that can help bring these prices down. So
if Mylan doesn't do this voluntarily, is it going to take lawmakers to step in? I know there's already congressional committees wanting to get a hold of this issue. I mean, how does this play out?
Well, yes, we think there should be comprehensive action on pharmaceutical drug pricing. There are options available to the president, options available to Congress and the states. But what really matters here is that Americans organize. Pharma has announced a $300 million lobbying campaign to defend its high prices, essentially from efforts by the American people to lower those prices. But if we stand up, if you add your name to our petition, help us get to 1 million names, we can push Mylan to do the right thing and reduce its price. And we need to pick up the phone, call our members of Congress and say we demand comprehensive action on drug prices because this type of abuse cannot stand.
Yeah, we're all focused on Mylan and EpiPen, but are there similar situations involving other drugs?
Well, of course. I mean, last year we had the famous example of a pharma bro and the AIDS drug hiked thousands of percentile points. But really, this kind of price spiking, most pharmaceutical companies jack up the prices of many of their products 10 to 15% every January 1st. And that's something we can stop through legislation. Mylan's case is disturbing because as a generics manufacturer, part of their role in the health system ought to be to help further reduce prices and the cost burden on all of us through simple market competition. And they're refusing to do that, instead looking to boost the CEO pay of which has now reached $19 million for Heather Bresch. But, you know, it's the general problem here is monopoly power. We give pharmaceutical companies all kinds of monopoly protections, essentially government-backed monopoly protections. That's the reason we don't have a true free market working in pharmaceuticals to bring prices down. And that is something we can do something about. There are many solutions to it. It's a very simple matter of Congress and our government doing what the American people want in poll after poll, and that is to stand up to Big Pharma.
Well, we will continue to follow this story, and we thank you so much. Peter Maybarduk, Public Citizen Director of Access to Medicines Program. We thank you very much, Peter.
Thank you.